I'm Dr. Michele McDermott, a menopause specialist at the Austin Diagnostic Clinic. I'm going to explain to you all of the different options that you have. These, like the compounded hormones, come in many forms. They come in pills, they come in patches, gels. In front of me I have just some examples of the bioidentical estrogen and progesterone that's available to be prescribed to you by your physician. When I see a patient, I actually show them many of these different options, and we take them out and look at them so that they can decide what they think would work best for them. So let's just start with a basic pill. This is a tablet that has bioidentical estradiol, which is just like the estrogen in your ovary, and as you can see, it comes in a very simple packet and there's nothing messy or difficult about it. It's covered by insurance and that can be taken once daily. Then there are also other types of bioidentical progesterone capsules. So many women believe that progesterone has to be taken in a cream form, but in fact the cream is not proven to be effective to prevent uterine cancer, whereas this capsule oral form has been tested and found to prevent the uterus from being overly stimulated by the estrogen. And so this is the best type of progesterone to use for preventing uterine cancer, is oral progesterone, or it could be a progesterone that's in a patch. So we have oral tablets, we have patches, we have gels of varying concentrations and delivery methods. These types of gels that come in a bottle are very simple to use. We just simply pump this bottle and a very small amount of gel goes on the arm, and then it is spread on the arm. It evaporates very quickly within a few minutes, and once it evaporates, the hormone is in your skin and the bloodstream picks it up and takes it throughout your circulation. So that's a very physiologic way of getting the hormones. Another type of hormone that goes through the skin are the patches, and these are very well liked by women because they're easy to use. They come in a variety of doses, so it's very easy for us to regulate the dose just right for you. And to do that, we talk about your symptoms. We don't just rely on blood levels. You may have heard that it's important to measure blood levels, but blood levels vary from day to day, and they really don't tell us how you're feeling. So because we have many doses, we might start with an average dose, or if you have a lot of symptoms, we might have a higher dose to start with. And the patch is easy to, as you can see, it just peels, the backing peels off, and it's applied to the lower abdomen. It's changed twice a week. It withstands heat, showers, baths. Even here in Austin, Texas, women find that it stays on perfectly well. There are some patches that contain both hormones, and of course that's a very convenient way of getting your hormone therapy. These are gels that are applied on the thigh. They come in little packets. And then there's even a bioidentical estrogen that comes in a spray. This is a little spray device that it's brand new, so the top is a little hard to take off, but this goes on the forearm, and just one pump delivers a low dose. So this would be a very good starting hormone when you're just having symptoms at the very beginning of menopause, but you don't need a very high dose. So here we have many options for you, and I would encourage you to speak with your physician, and if they're not familiar with these choices, then look for a menopause specialist like myself. The way you can find a menopause specialist is to go to the website for the North American Menopause Society, and that's menopause.org. On that site, you'll find a tab that says Find a Doctor, and you'll find that there may be a menopause specialist in your area. Just remember, when you feel stressed and worried and overwhelmed with all of the information that you see on the internet and hear from your friends or relatives, take pause and remember that there are many choices and specialists there to help you.